Hello, my name's Liz. I'm going to be your student nurse today. Can you tell me your name and date of birth?
Justin Braun, 8/10/92.
Okay, so identify my patient. I'd be performing hand hygiene. Close the curtain for privacy. So I'm going to be performing a head-to-toe assessment. Do you have any questions?
No.
Is the room comfortable for you? Do you need a blanket? Can you hear me okay?
Yeah.
Do you need to use the restroom before we begin? So before I begin my head-to-toe assessment, I position myself so he can hear me. Also, I'm using therapeutic communication through this whole head-to-toe assessment. So just general survey, just looking at Justin, he is sitting up appropriate. He's kind of just in a tripod position here. His mood is positive, seems exhausted. His hygiene is appropriate. His grooming is appropriate. He's wearing appropriate clothes for the weather. He's got no shoes or socks on right now. Do you know where you are?
Home.
Home. And do you know what time of day it is?
Evening.
Okay. And what day is it?
Friday.
Okay. And do you know who the president is?
Trump.
Alright, so he's alert and oriented ×4. I'd assess vital signs at this time, but we're going to skip that. So now moving on, I'd first assess his hair. So just looking at his hair is brown. It's evenly distributed. I'm going to touch your hair. I'd have gloves on if I feel like I needed them. It's evenly distributed. Like I said, it's smooth, it's moist, it's not thin, and it's not thick. I'd also be looking around the bases of his earlobes and around his neck for lice or parasites, which I don't see any. Next, I'm going to go just looking at his head. So his head is symmetrical. Its facial features are symmetrical. The size is appropriate, normal cephalic. His smile is symmetrical. Can you puff out your cheeks for me? Good. And raise your eyebrows. Good. And smile again. So his facial features are symmetrical. So now I'm going to look at his eyes. So just looking at his eyes, his eyelashes are evenly distributed. Eyebrows again are evenly distributed with hair. I don't see any eye boogers coming out. The sclera is white, it's smooth, there's no lesions. I'd have gloves on. I'm going to pull down your conjunctiva. It's red, moist, and smooth. Okay. I'm going to shine a light into your eye, and I want you to just look straight at me. Okay. Do it again. Good. So his pupils were about 4 millimeters in size, and then they constricted. So that's appropriate. I want you to look at my pen light all the way to your nose. Don't move your head. Good. And follow my pen light with your eyes. Don't move your head. Good. So his eyes are pearl. Pupils are equally round and reactive to light and accommodated. Next, I am going to assess your ears. So looking at his ears, they are the same size. They're aligned with his outer canthus of his eyes. Also, they're smooth. They're warm, they're moist, they're appropriate in ethnicity. Same way with his face, it's smooth, it's moist, appropriate for ethnicity. Also, looking at his ears, I note no pus, blood, or drainage coming out. His ear canal is the same way on this ear. Also, I'm going to palpate for contour and elasticity. Is there any tenderness? No? Good. So, I'm going to assess for hearing at this time, so I'm going to have you sit in the chair. And I am going to stand behind you, and I want you to close off one ear for me. Good. And I want you to tell me when you hear this hair rolling.
Yeah.
Okay? Do the other side. Tell me when you hear this.
Yeah.
Okay. And I'm going to whisper 3 letters. I want you to repeat them.
ABC.
Okay. So his hearing is intact. And next, I'm going to assess his nose. So just looking at his nose, it's appropriate in color. It's smooth, it's moist, it's not dry, it's warm. Is there any tenderness when I do this?
No.
Good. So I don't know gross in his on his nose, in his nose, feeling on that. No nasal flaring. I'm going to look up his nose. Actually, he's done yawning. So looking up his nose, there's no pus, blood, drainage coming out, no polyps growing, no abnormalities. I want you to occlude your nostril and breathe for me. Good. And other side. Good. So his nares are patent. Next, I'm going to palpate his sinuses. Is there any tenderness?
No.
Good. So now I'm going to do his mouth. So just looking at his mouth, his outer lips are pink, they're moist, and they're smooth. Can you pout your lip for me? It's also pink, moist, or smooth. I'm gonna have you open your mouth for me. So looking in his mouth, it's pink, it's moist, I note no lesions. His teeth are very well kept care of. I don't notice his gums are bleeding. His tongue is midline. Can you stick out your tongue? Good. His tongue is midline, it moves when he is prompted to. The back of his throat, his oropharynx is smooth, it's moist. Can you say ah for me? Good. His uvula is midline, and also his tonsils are not inflamed, and they're normal in color. They're not pink, and I know no tonsil stones. Next, I am going to assess his neck. So just looking at his neck, it's appropriate in ethnicity. It's smooth, it's moist, and it's warm. I want you to tilt your head to the side. Good. There's no JVD in other side. Good. No JVD. I'm also going to palpate your trachea, so tilt your head up. It's not deviated to one side. I want you to swallow for me. Good. So his thyroid moves interior like it's supposed to. I'm also going to palpate his lymph nodes. So I'm going to start on the back, occipital. Tell me if you have any tenderness. Postauricular, preauricular, submandibular, submental, also posterior cervical, which is on the back side of his submandibular, I can't say that muscle, and then his preauricular, or anterior cervical, and then his supraclavicular. Any tenderness there? Okay, good. Next, I'm going to feel his carotid arteries, one at a time. The other side. So they are strong, they're have a regular rhythm, and they're not bounding, and they're bilateral equal. So next, I'm going to listen to his carotid arteries. So I note no bruise or thrills. Next, I'm going to assess his chest. So I'm going to pull down his shirt a little, and his chest is a normal in ethnicity and color. It's smooth, it's moist, it's warm. Also, his chest is rising, symmetrical. I'd also look at the shape of his chest. It's not barrel or funnel. Also, I'm looking at the back. So looking at his back eye, again looking at the color, it's normal for ethnicity, it's smooth, it's moist, and it's warm. I'm going to palpate his spinal column. Any tenderness here?
No.
Good. And his column is midline. I'm going to have you scoot forward for me just a little bit in your chair. Okay, so I'm going to find his kidneys and I'm going to palpate. Any tenderness?
No.
And palpate again. Any tenderness?
No.
Good. And now I'm going to tactile firmness. So I want you to say 99.
99.
And again.
99.
Good. I want you to take a deep breath for me. Good. So his chest rises symmetrical. Next, while I'm on his back, I'm going to listen to lung sounds. Take a deep breath and exhale. Deep breath. Exhale. In between intercostal spaces is what I'm listening for. And then since I can't get to it without taking his shirt off, I listen here and here for lung sounds, and also in the lower lobes. So here and then again on the other side. All right, you can sit back in your chair. So now I'm going to listen to lungs on the front. So in the intercostal spaces. Good. Good. And I go down more into the middle. Good. So I can't get down again with his shirt, but I listen here, here, and more towards the lower lobes, and I don't note any adventitious sounds. Also, his respiratory rate and rhythm is not labored. It's also a regular rhythm, and it's within normal limits. Next, I'm going to listen to heart sounds. So I'm going to start on the aortic. I'm going to do the pulmonic. I do the Erb's point. And then I'm going to reach down and get your tricuspid here. The chime right here. And I'm going to have you raise this arm up a little bit. And midclavicular line, fifth intercostal, the apex. The mitral. And I'm going to get his pulse for a minute. All right. So I got an apical pulse of 88, which is within normal rate, and it was strong, and I didn't note any S3 or S4 sounds. So next I'm going to assess his abdomen. So I'm going to have you lay back on the bed for me. And I'm also assessing his gait right now. He's not leaning to one side, he's balanced as he walks. Is it okay if I pull your shirt back?
Sure.
Okay, so I'm going to pull his shirt back. So just looking at his belly, it's appropriate in color, it's smooth. The contour is also appropriate, it's not distended. There's a little bit of extra adipose tissue. Again, it's symmetrical, it's not leaning to one side. I'm going to now also take your bowel sounds. I'm going to start in the right lower quadrant. And I listen for a minute in each quadrant. And I'd also listen down the descending aorta. Hear any bruise or thrills? Sorry if my stethoscope is cold. And I forgot to note earlier that I would also assess his heart sounds with the bell of my stethoscope as well. So next I'm going to lightly palpate his abdomen. Tell me if you have any tenderness. So in all 4 quadrants. Any tenderness? And I'm going to go deeper. Any tenderness? No? Good. I would also percuss, but it's not on the rubric. All right. Do you have any problems with going to the bathroom at all? So if he was having urine retention, I would palpate the area of the bladder to make sure I don't feel his bladder, because that's a sign of urine retention. All right, I'm gonna have you sit back up for me on the side of the bed. So now I'm just going to assess the upper extremities. So his upper extremities are appropriate in color, size, some warmth. They're moist. I'm going to assess muscle strength. So I want you to pull up on your shoulders. Good. And I also want you to tilt your chin down and back. All the way back. Good. I want you to put the ear to your shoulder. Good. And the other side. Good. So his muscle strength is intact. I'm also going to assess his hands. So looking at his hands, it looks like he's a hardworking guy. He's got some dirt in there. Looks like it's embedded and not going to come out. His fingernails are kind of chipped. His cap refill is prompt. Skin turgor is prompt. And turn your hands over. They also are embedded with dirt, but they are clean. There's no cuts. All right. I'm also going to check your range of motion with your wrist and assess for any crepitus. So I want you to twirl your wrist as I feel for crepitus. Okay, I don't note any. I want you to move your arms back and forth. Good. And I want you to roll your arms. Good. And then act like you're gonna punch. Good. So he's got full range of motion in his upper extremities. I'm also going to do light touch. So I want you to close your eyes for me. Tell me which arm you feel this. Good. 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 I'm also going to have you push your hands against mine and push. And don't let me push you. Stronger than me. Next, I am going to assess pulses. So I'm going to palpate his radial pulse. And they're symmetrical and strong. Regular in rhythm. His brachial. They're strong, symmetrical, regular in rhythm. Next, I'm going to go to his lower extremity. So just looking at his legs, they're not purple or any redness. There's no varicose veins. There's no edema. His hair is evenly distributed. Color is appropriate for ethnicity. It's smooth, warm, and moist. Same with this leg. Also looking at his feet, they are clean. They're cold, probably because he has no socks on. Also, I'm going to look underneath your feet, especially if you were diabetic, for any ulcers or wounds. So no ulcers or wounds. So I'm going to check your cap refill. It's less than 3 seconds. Less than 3 seconds. I'm also going to assess your pulses. Strong, regular in rhythm. I'm also going to assess skin turgor. It's prompt. I'm going to assess his dorsalis pedis. posterior tibial. I'd also feel for his popliteal, so I'm going to go behind your knees. I want you just to relax your knees for me. They're also, oh, I found it, strong and symmetrical. Alright, next thing I'm going to have you do is push your legs up, or your feet up. Good. And push down like a gas pedal. Good. And I'm also going to have you push your legs out towards me. Good. Alright. Last, two more things. I'm going to do a light touch again. So close your eyes. Tell me which leg you feel this. Good. And I want you to twirl your ankles for me. I'm feeling for crepitus. There's a little bit of crepitus in there. Alright, and I want you to push your legs up, act like you're going to kick. Good. Again, I want you to swing your legs out into your hips. Good. Good. So he's got full range of motion. And I assessed his gait earlier as he was walking from the chair to the bed, which it's appropriate. He's not slouching at all. He doesn't have any problems with ambulation. Do you have any questions for me? That concludes my assessment.